the Pacific Research Institute's Next Round podcast. I'm Rowena Ichon, COO, and with me, as always, is Tim Anaya, Vice President of Marketing and Communications. So, Tim, I thought we could chat about an article that we both saw in Cal Matters by a reporter named Alexei Kozhev. And if you haven't heard of Cal Matters, it's really a terrific online news source for all things related to issues and politics at the state capitol. So this article that caught my eye was about the lack of access by journalists following state government at the Capitol. And frankly, I was pretty shocked. As a former spokesperson, this was amazing to me. According to this article, government agencies are asking for questions in advance and not willing to attribute information to their spokespeople and not answering questions on email versus on the spot. You know, when I was a press spokesperson, Tim, the rule is that when you picked up the phone, you were on the record, unless, of course, you clear things up first, whether it's on background, but you were on the record. And if you were not on the record, it hurts your reputation and your own firm's organization. You got to wonder why these government spokespeople are letting this happen. This is why you get picked for these jobs, because you've got a lot of information in your heads. You could explain things quickly and accurately, and you can even come up with a soundbite or two. I'm just surprised by all this. What do you think?
Well, that's exactly right, because I've also been a press spokesperson, and the orientation of whoever it is, an elected official or a state agency, they don't want to talk about what they don't want to talk about. They just want to talk about what they're presenting. And I get that. But it's your job. You have to answer every question that comes in, especially when you're serving the public. The people and the news media have a right to know. And my job, when I was serving in a press spokesperson role, I would always be fighting the individual for we've got to put this information out. We've got to give more information than we are. We've got to answer their questions in a timely manner. Now, maybe I was a little different in how I approach things, but I always was pushing for, the more we can answer, the more background we can provide. You don't risk the opportunity for your words to be twisted or for the story not to appear as it is when you give them the access and the background information and make smart people available to walk them through an issue, particularly if it's complex. Now, I appreciate there are some times when you get reporter phone calls about things where you can't make an announcement. Your boss is not giving you the green light to announce something or release some information. But that's when you're honest. That's when you just say, instead of kind of playing the games that we read about in this article, that's when you say, hey, I don't have an announcement for you today. You'll be the first to know when I do. Sorry, I'm trying to get you an answer, but I don't have one yet. They can kind of appreciate what you're going through on the inside, but you lose your credibility as a spokesperson and an honest broker when you play little games like this. If you want a written comment, I will gladly give you a written comment. If you want just to speak to me on the phone, I will gladly speak to you on the phone. If you want to speak to the principal and not me, I'll do my best to make that happen as well. Whatever you need to do your job as a reporter, that should be the hallmark of every press spokesperson. Make it easy, not hard for them to do their job. Now, the current dynamic we're in, I would argue, and you could read between the lines in this article, the reason that we're having this problem today, this is an attitude of the news administration. They, top to bottom, their team, although there are good people work there who I know and respect and who are good, smart, solid people, there is an orientation of arrogance. There is an orientation of just spoon feed what we are giving you. There is an orientation of we're in control, not you. During COVID, the governor famously did his daily briefings. Those slowly over time, as the press rightfully started to ask tough questions about the no-bid mass contracts and other things, they started cutting off in-person events. They started having online-only events where only particular reporters were called upon. They started doing these things where, they'd only respond to written questions. That, to me, is a sign of an out-of-touch administration that needs to be held accountable. The solution to this problem is the press should be doing more of what they're doing. they should ask even more tough questions. They should ask even more, have even more stories of, these questions are unanswered. The public has a right to know where are the answers to these stories. Every year we have Sunshine Week, which is about this time of year, which is about openness in government records, laws, and press access to government. Sounds like with the news administration, we should be having those kinds of stories every day, because they really are pretty much operating kind of in the dark and only with, kind of made for TV, slick events, and avoiding the tough questions wherever they can.
Answering questions, journalist questions on an email is not going to help your rapport with the reporter. They were my friends. I knew where these journalists went on vacation. I knew where the names of their kids. I had drinks with them. And when you have a sticky situation, that's when your relationship comes into play. That's when the reporter says, yeah, I get it. I understand. I know you don't have an answer for me. This is a touchy issue. I get you. We're friends. I want access next time I have another situation. And you do this kind of back and forth. You create a rapport, you create a bond, even though you may not always be on the same side. But if you're answering a cold email with some canned response, that's not going to help the situation. And what do reporters do? I think you're exactly right. You have to, as a journalist, you have to keep on and get the hard-hitting news and work hard to get these insider stories so that the government spokespeople start to shape up and do their job and deliver on the information and help you write your stories and shape your stories as a good spokesperson should be able to do.
What was also shocking in this story was the issue of Public Records Act requests. Back in the day when I worked in the legislature, one of the key things that we did was during the rolling blackouts of 2001, Gray Davis was entering into all of these big taxpayer-funded secret power contracts with energy providers to provide a certain amount of power to the state to prevent rolling blackouts going forward, because largely the issue was a supply issue. And the administration refused to disclose the contracts or what we were paying. So that's when I learned how to write Public Records Act requests and file them. And we did it, and we had to go to court ultimately, but we got those contracts released, and we knew what a huge amount of money taxpayers were paying because we filed that Public Records Act request. And ultimately, that was one of the key things that led to the recall of Gray Davis. It seems to me that reporters, I was shocked with how much they are really kind of just ignoring or really responding in very silly ways to Public Records Act requests that amount to a little more than Stonewall. I mean, you're supposed to respond within 10 days, and there are provisions where you can deny records or say that it's going to be a great time or expense to put them together. But they're just, it seems like, willfully dismissing them. I feel like they need to get some more lawyers on retainer and take them to court time and time again to get this information released. Again, taxpayers and the media have a right to know.
Well, we'll definitely be watching this issue because it's important to Californians. It's important to researchers, think tanks like us. And as Tim and I are both spokespeople and communications professionals, we have a personal interest in this and think that, it's wrong for the government to shut out journalists like this.
Yes, Alexi and others, call us anytime. I will gladly answer the phone, and either myself or one of our PRI scholars will be on the phone momentarily to answer your questions.
So everyone, friends, this is hot off the press. Invitations are mailing out. Our guest speaker for PRI Southern California Gala this year is Art Laffer. And as many of you know, everyone knows, Dr. Laffer popularized the Laffer curve. He was an economic advisor to President Ronald Reagan and Donald Trump. If you've ever seen him live in action, but he's a tremendous speaker. He's funny and witty and very personable. He has a new book out, Taxes Have Consequences. We'll be giving out signed copies of those books. So we hope you can all join us. It's May 11th at Costa Mesa Weston on the evening, and we will have a lovely time.
And then coming up soon, in a couple of Fridays on April 28th, we're going to have a great webinar discussion with Dr. Leo Hanian, the great economist, Hoover Institution senior fellow, UCLA professor. He's going to be in discussion with our Dr. Wayne Weingart and talking about California's growing out migration problem, our worsening quality of life, our rising cost of living, all of these sorts of issues that are mainly economic policy related that are contributing to so many problems facing California today, and then also what we can do about it. So it's a free webinar that'll be on Zoom on Friday, April 28th at 11 a.m. Pacific time. If you're interested, please join us. Register online at pacificresearch.org to get your spot.
So for this week's podcast guest, we have a favorite PRI president and Thomas W. Smith Fellow in Healthcare Studies, Sally Pipes. And she's going to talk about two healthcare bills that are coming up in the state. One's new, another one's a retread. So Senate Bill 770 is a new bill by Scott Wiener, and it's more of an incremental approach to bringing single payer to California. The other, well, that's same old bill sponsored by Ash Kalra, probably a few minor modifications. That would completely change the healthcare of California and put it all in the hands of government. So Sally will be explaining both bills and why they should matter to Californians. And she's also going to touch on what Bernie Sanders is doing at the federal level as he is the chairman of the Senate Health Committee. So thanks so much for listening. And here's President Sally Pipes. Sally, we're happy to have you back to talk about the renewed push for single-payer healthcare in California. So this year, there are two proposals that have been introduced in the state legislature as Sacramento progressives seem to be divided among themselves on the strategy. So let's talk about the new bill, which is Senate Bill 770 by Senator Scott Wiener. This bill is being promoted as being part of a more incremental approach to single-payer. Tell us about SB 770 and share with us your thoughts on this proposal.
Well, thank you, Ro and Tim. I'm delighted to be back. And just a little quick quip at the beginning. The old saying, history doesn't repeat itself. It's the same damn thing over and over again. And here we are with single payer, not just one bill, but two. And SB 770 was introduced by San Francisco Democrat Scott Wiener. The bill was amended on April 11. It was most of the edits were copy edits, really, but they did add Mr. McGuire to one of the sponsors. So there are two sponsors for SB 770. The first hearing on this bill will take place on April the 19th. So it will be interesting. I haven't been invited to testify or provide content myself, which is not surprising. This new bill, SB 770, is what we call a unified funding bill. What they would be doing under this bill, if it were passed, would be to try and get from the Secretary of HHS, Mr. Javier Becerra, former Attorney General in California, who's a big proponent of single payer, to get him to approve that the federal government would give a waiver to California to get the Medicare and Medi-Cal payments so that they could use them to determine how to get health care for everyone in California and provided by the government. Oh, and just to add one thing, the bill would, if it were passed and they did get the waiver from the feds, the bill says it has to be in place by June 1st, 2024, which is just over a year from now.
That is really the $64,000 question. We know obviously that Secretary Becerra is a big single payer proponent. So what do you think he would do if this bill became law and California sent him its waiver application? Governor Newsom, of course, tried this when Donald Trump was president, and it did not move ahead, but we have kind of a different dynamic now.
Well, you're absolutely right, Tim. When Governor Newsom was elected for the first time as governor of California, early in 2019, he went to President Trump asking for a waiver. But of course, it didn't come through. But with former California Attorney General Javier Becerra, now Secretary of HHS, and I mentioned earlier, a big proponent of single payer, I would think that he would feel some kind of compulsion to actually approve it. Whether that would be challenged in court, I don't know, but I think he would be definitely in favor of trying to get single payer in California because he is a proponent of it.
So not to be outdone, Assemblyman Ash Kalra is back with another try to create a single payer healthcare system in California with AB 1690. So for our listeners who may not remember, give us a snapshot of what Kalra's approach would be and why it would be so bad for California patients and our healthcare system.
Well, I hope this is not going to be what we call third time lucky. This is his third attempt at getting single payer passed in California. He's, of course, a big proponent of it. The first time was in 2017. It was withdrawn by the then Speaker, Anthony Rendon, a Democrat, who said that Kalra's bill was woefully incomplete. So that wasn't enough to make him sort of move on to some other issue. Then we saw in 2021 Assembly Bill 1400, which was another attempt by him. And this bill, AB 1400, was withdrawn just before the deadline to even proceed to a vote. And I think, although, as I said, Rendon said the first one was woefully incomplete, this one, I think the Democrats in the Assembly had no support for a bill that would have doubled the California budget of about $285 billion a year to about $400 billion a year. So it would have been incredibly expensive. If it passed, what would happen? Well, we would have seen the best doctors would leave the state of California. There would be a doctor shortage as a result. The best and brightest kids would not go into medicine at in the California universities. And there would have to be a huge tax increase. And as you know, California has the highest state taxes in the nation already. So I think they realized that this was not going to be a go. But not to be outdone, he's back again with AB 1690. And it's another very detailed approach to get single payer in the state. So we have one bill, SB 770, which is a stepping stone approach to single payer by trying to get this waiver and then ultimately moving to single payer, versus Ash Kalra, who wants to get the whole thing done right away. And as we know, the nurses union in California has been a big proponent of Ash Kalra and single payer. When Governor Newsom was, running for re-election, and he was re-elected in 2022, as you know, he didn't come out in favor of Ash Kalra's single payer bill. He kind of stayed on the steps and set up a healthcare commission to look into single payer in the state. So I think the nurses union was very irritated that because they supported Newsom in the election, that he didn't come out and support single payer. We just saw a couple of weeks ago that the nurses union is very much on the side of Ash Kalra and his single payer bill. They held 45 protests around the state in support of his go to single payer bill right now, not having to wait for a stepping stone approach, which would begin in 2024.
Obviously, Assemblyman Kalra's prior efforts, as you mentioned, crashed and burned due to the lack of votes. But, since then, we've had an election in 2022, and the new legislature arguably is more liberal than last year's legislature. So do you think Kalra's bill stands a better chance of passage this session? Or do you think maybe the Wiener bill, as a stepping stone approach, gives skeptical Democrats a more politically acceptable, if you will, single payer bill to vote for as an alternative?
Well, I guess I would say, Tim, that no question, these are two competing bills. The legislature in California after the last election is even more liberal progressive than it was before. So I'm very worried about this, but I do think that with a estimated or forecast deficit for the state of $22 billion in the coming fiscal year, that I think the members and Democrats and progressives as well would be very adverse to moving forward with the Kalra bill, and would be more likely to push forward with Senate Bill S 770, the Wiener-McGuire bill.
So, Sally, both of these bills beg the question, where does Governor Newsom stand? The governor has certainly been an active single-payer proponent to attract support from the nurses union, and even convened a single-payer commission to advise him on the issue, which went nowhere. But he has been remarkably quiet on these two measures. Where do you think the governor will ultimately come down on? And as he has been promoting his liberal credentials across the country, does he actually want a single-payer bill to come to his desk?
Well, it's difficult to know, but as we do know, he is moving more and more to the left. He went down to Florida and went to Sarasota to New College and said, he wants to bring the New College idea to California, more wokeism, more critical race theory. And this is a college that Governor DeSantis has just replaced the president, the chairman, and all the board members to move away from wokeism and get the college back on a stable track. So I think it's hard to say what Newsom will do. It seems that he is on the path to trying to challenge President Biden for the nomination. And if not in 2024, probably in 2028. So he's always supported it, as I've said. In the last go round with Culra's AB 1400, he didn't really say anything. And I think it was because he was worried about his reelection. And of course, he won in a landslide. But certainly, the nurses union were upset with him with not taking a strong stand. What will he do? I mean, certainly he set up that the single payer healthcare commission in California. None of my friends was on the commission, of course. The report finally came out. It was delayed because of COVID, but it really was a nothing report and nothing has been done about it. So I think it was just a ruse to try to get him off the hook to make a statement because he was waiting to see what the commission recommended in terms of single payer, how much it would cost.
Of course, single payer isn't only being pushed in Sacramento. We're seeing the Senate Help Committee chair, Bernie Sanders, that's an ironic acronym, HELP, continue his quest to enact Medicare for all at the federal level. Now, he knows it's not going to go anywhere with the current makeup of Congress, but he's using the committee and his ability to have hearings to push universal coverage and make the case too for price controls on drugs. So bring us up to date with the latest on the push for government-run healthcare in Washington. We also see other states like New York and Oregon are pushing for single payer.
Well, exactly. I mean, I think, Senator Bernie Sanders is delighted to be chair of the Senate Help Committee. And as you kind of groaned, Tim, health, education, labor, and pensions. He's probably the most progressive person in the Senate. He's not a Democrat. He's an independent from Maine. His lifetime goal is to get single payer healthcare for the country. I call him the Pied Piper of single payer healthcare. But he has said himself in hearings and in the Senate that he knows single payer healthcare cannot come about nationally with the current makeup of the House in particular. So he's pushing on other things, pushing the stepping stone approaches, such as universal coverage, which would mean that there would be private healthcare and more government healthcare along the way. And of course, price controls on pharmaceuticals. And we've already seen under IRA, the Inflation Reduction Act, that starting on January 1st, 2026, the government will put price controls on 10 drugs under Medicare Part D. They will be increased going forward. And probably, I think Bernie Sanders would like price controls on all pharmaceuticals. That will be a little bit more difficult. But I think Sanders knows, as I said, that single payer isn't going to go right now, but he is certainly never going to give up on that. And he has his best proponents along with him, AOC, Alexandra Ocasio-Cortez, and Pramila Jayapal from Washington State, who has also written a few bills on single-payer healthcare, and she is an extreme progressive. If we look at what's going on at the state level, in addition to California, of course, New York State for 30 years has been trying to get single-payer in the state of New York. Each year that it comes up, it goes down, because it would need $139 billion in new tax revenue. And that would be 156% more than the current tax rate in New York. So every time it goes down. But, 30 years of trying, I worry that, one of these tries it will actually happen. And in the very progressive state of Oregon, we saw in the last election that the voters in Oregon passed an initiative to make healthcare in the state of Oregon a right. We don't really know what the details are, but healthcare is not a right. It's a good like any other good, and it's subject to the forces of supply and demand. Oregon is also now pushing with a single payer bill in that state. So we'll see what happens there. But at the moment, there are many states that are looking at this, and I'm very worried because we have so much evidence, and I can talk about that later, about how single payer systems in Canada and the universal coverage system in the UK are proving to be a disaster. Why would we want these disasters in our country?
So, yes, that brings me to the single payer front. You've written about the new phenomenon of private health clinics opening up in Canada, particularly in Ontario. They are still illegal under the Canada Health Act. Private healthcare is legal in the UK, and now over 11% of Brits are using private care. In the latest poll, for the first time since its inception in 1948, only 29% of Brits are satisfied with the NHS system and the long waits. So what lesson should policymakers and others open to the idea of single payer take away from this new trend in Canada and the dissatisfaction with the NHS's universal coverage system in the UK?
The experience of what is going on in Canada, which has a true single payer system, one of 3 countries in the world, Canada, North Korea, and Cuba, and what is going on in England under the NHS. By way of background, on the night before Good Friday, which was April the 6th, the Canadian Supreme Court declined to take on the private case of Dr. Brian Day and his private Cambie clinic, which was very disappointing. And there's a huge uproar about it. And this is particularly important because in 2005, under Madam Justice Beverly McLaughlin, who was chair of the Supreme Court at the time, in the case Chaouli, Dr. Chaouli versus the province of Quebec, she ruled that people in Canada, and it will in Quebec in particular for this case, are entitled to life, liberty, and the security of the person. Therefore, access to a waiting list is not access to health care. And this decision opened up private healthcare in the province of Quebec. We are seeing healthcare and private clinics opening up in several provinces, but it's very sad that the court is not going to allow, with their decision, a private Cambie clinic to stay open in British Columbia. It's noteworthy that Ontario Premier Doug Ford just a couple of months ago announced that he's going to be opening up private clinics in Ontario because he says that it is not fair that the residents of Ontario have to be denied healthcare and be on long waiting lists, which is harmful to their health. So, we're seeing Ontario, Quebec, the provinces of Saskatchewan and Alberta are opening up to private clinics to try and reduce these long waiting lists. And the Supreme Court is not letting this move forward in the province of British Columbia. In Canada last year, the average wait from seeing a primary care doctor to getting treatment by a specialist, 27.4 weeks. That's over half a year. And, some Canadians have an escape valve. They can come to the US and pay out of pocket for healthcare. And over 200,000 Canadians do that every year. So the waiting times are getting worse. The shortage of doctors in Canada is at a staggering level, and particularly since COVID, more and more doctors have retired. In the UK, the National Health Service, as was pointed out, came into being in 1948. It is a universal coverage system. They allow private care to run parallel to the National Health Service. It is noteworthy that today, over 11% of Brits are now signing up for private healthcare coverage, and it is growing because of the long waits. In Britain today, there are over 7 million Brits on a waiting list for healthcare. It's absolutely outlandish. And so in the recent poll that came out in the UK, for the first time in its history, only 29% of Brits support the National Health Service. As in December, 54,000 Brits waited more than 12 hours for ambulance care to get to an emergency room. So that is a tremendous number of people. We just saw in the UK that this week, the junior doctors under the National Health Service voted to go on strike for 4 days. That means that 61,000 junior doctors, who are all members of a union in the UK, have gone on strike for 96 hours, meaning that 350,000 medical appointments and surgeries have been canceled in the UK. Are these the kinds of statistics and type of healthcare that we want for our country? If the Americans could only realize and listen to people like myself, educating them on what these healthcare systems mean for their healthcare, they would probably not be so supportive of such takeover by government of the healthcare. And in California, if either of these bills passes, and particularly the cholera bill, if it moved forward, we would see the same thing. Doctors in our state would become union members, and they would be able to withdraw their services if they don't like the rates that the California government is going to pay doctors for their services. So these are very worrying trends, but we have evidence that these systems do not work. And so let's move forward with reforming our healthcare system with market-based solutions that will bring about affordable, accessible, quality care for all people in this country.
So single payer isn't the only hot healthcare topic in California this year. Another idea that's being kicked around is to expand eligibility for Medi-Cal to all undocumented living in the state beyond those who are currently eligible due either to their age or their income level. So what would be the effect of this proposal on taxpayers and the state healthcare system if it goes through?
So this is a very worrying thing. And actually, President Biden has been sort of fussing around saying in recent days that he thinks that all undocumented immigrants in the U.S. who came in under the DACA bill should be eligible for free health care in this country. Under the Affordable Care Act, Obamacare, undocumented immigrants or illegal immigrants were not eligible to sign up for the exchanges. But this move in California, Governor Newsom keeps trying to move closer and closer to getting all undocumented immigrants covered under our version of Medicaid, which is called Medi-Cal. If effective on January 1st of 2024, 700,000 plus undocumented immigrants signed up for Medi-Cal coverage, this would be at a cost of $2.6 billion a year. It would mean tremendous new tax increases in the state to cover this. And as I mentioned, Californians pay the highest state income taxes in the country. So I think this would result in more doctors leaving California for states where this is not the situation, where they'd have to take Medi-Cal patients, because as you know, patients on Medi-Cal only bring in about around 72 cents on the dollar to hospitals and doctors who treat Medi-Cal patients. So we're already seeing that a lot of patients on Medi-Cal are having a hard time finding a doctor today, and the waiting times are very long. So if we're going to add another 700,000 to the program, it's going to mean longer waits and more difficulty for these patients to get coverage under Medi-Cal. And as I say, docs will leave the state and move to states that are friendlier to them and how they do are able to practice medicine.
So, Sally, at the local level, there is a ballot measure being pushed in the city of Los Angeles that would limit the compensation of hospital executives to what the president of the United States takes home in salary. So you've made the case that this measure, if enacted by voters, would have a very negative effect on local hospitals and their ability to attract top executives to run their hospitals. How's this the case?
Well, the California Hospital Association is trying to bring a court case against this initiative to put it on hold or to eliminate it. They've tried the SEIU, the big union that's trying to build its base every day, build it, have more and more members, is behind this. And they, of course, want the executives at hospitals in Los Angeles to have their pay limited to what the president of the United States earns, which is currently around $415,000 a year. It would also include a combination of their bonuses and any other amenities that they get with any other benefits they get with their health care. I think the result of this, if this were to become law, the best hospital executives in the state of California are going to leave our best hospitals, whether it's City of Hope, UCLA Medicine, UC Irvine, UCSF. These are really world-renowned hospitals that need top executives to run them. If the CEO of one of these hospitals can only earn $415,000 a year, they have specialists earning upwards of $1 million a year for providing tremendous care. It's really going to be very sad for California and our healthcare system, because we would be losing some great executives to other states that would offer them the ability to be paid for the value of what they are providing. Kaiser Permanente Health had a CEO who sadly passed away from a heart attack a couple of years ago. His name was Bernard Tyson. He was being paid $16 million a year to run the Kaiser system in California. And so, 16 million versus 416,000 is a lot of money. I don't know what it's. A lot of hospital CEOs are making a lot less than 16 million, but it would be devastating for the quality of executive that our hospitals would be able to attract if this were to become law. But it's another grab by the SEIU trying to build their base. They want single payer. They want to control what doctors are paid and what hospital executives are paid.
So finally, as we close, Governor Newsom has announced his selection of a company to manufacture low-cost insulin for California and actually compete directly with the private manufacturers. So looking at these proposals, should the state really be in the drug business at all? Make the case for why this is a bad idea for Californians.
Well, I think it's an absolutely terrible idea that it's sort of getting the camel's nose under the tent for California being able to get into the business of manufacturing drugs. We have a very a wonderful pharmaceutical industry, which has provided the very latest in cutting edge drugs for all Americans, not just those in California. So I think the Governor Newsom wanting to, have a company compete directly with the private manufacturers is a terrible idea. And also, there are three main diabetes drug manufacturers in this country: Eli Lilly, Santa Fe, and the Danish company Novo Nordisk. In March, Eli Lilly announced that they were going to cap the price of insulin at $35 a month in terms of what out-of-pocket cost you would pay. Santa Fe and Novo have not said whether they're buying into this or not, but they probably will feel pressured into it. I think it's very upsetting, even what happened at pushing this at the federal level, because we have a lot of great innovations in the diabetes space, and if companies, the pharmaceutical companies that produce these insulin products and different products to compete to solve the diabetes problem, we're not going to see the kind of innovation that we've seen in the past, this kind of innovation will not go forward. So why should why should Governor Newsom be getting, into the drug business when we've already seen Eli Lilly is already capped their price at $35 a month? This is not a space that the California government needs to get into.
Any final thoughts, Sally?
Well, I wake up in the morning and I'm kind of depressed about what is happening with healthcare in this country. And I just am not going to reduce the amount of effort that I'm putting into educating Americans on the kind of healthcare system, the market-based system that will lead to affordable, accessible, quality care for all, and to educate them on why these universal coverage systems like the NHS in the UK and Canada system are disasters for patients. And this is not what Americans want. We want to have affordable, accessible, quality care for all, and market-based solutions, opening up the system rather than reducing it to one of complete government control is the wrong way to go.
Thanks so much.
Thank you.
If you like this episode, please tell your friends and subscribe to PRI's podcast at iTunes, Google Play, Stitcher, TuneIn, iHeartRadio, and Spotify. And when you're on these platforms, don't forget to give us a big 5 stars. If you don't subscribe to any of these, you can still listen on PRI's YouTube page, youtube.com/Pacific Research 1. That's the number 1. Thanks for listening. I'm Rowena Ichon. Hope you'll come back again for next round with PRI.